Dr. Anurag Saxena, Head of Department of Neurosurgery at Manipal Hospitals, Edinburgh. And in this video, we are going to talk to you about the symptoms of brain tumor or the signs which you have to look for, and those can indicate brain tumors. Now, brain tumors produces certain clinical problems which can be briefly categorized into general problems which most of the tumors will have, and then the problems largely dependent on the location of the tumor. It means where exactly it is located inside the brain, and that part of the function of the brain is affected, and then you develop symptoms. So one of the common symptoms which you see is headache. Although it is not the commonest symptom, but it is a common symptom. All headaches do not indicate brain tumor. That is another important question which is asked, is that I have a chronic headache, can I develop brain tumor? The answer is no. Brain tumors can cause headache. A special type of headaches which are more on straining, coughing, bending forward. Headaches which are more in morning, they are associated with nausea and vomiting sometimes makes the headache better. They might indicate raised intracranial pressure, which means the pressure inside your brain is high, and that can indicate in certain cases an underlying brain tumor. Other important causes, whenever the brain is irritated because of the tumor, you can have seizures, normally called as epilepsy or fits, or in Hindi you called as mirgi ka dora. This is another generalized symptoms which this kind of tumors can have. Other common symptoms which are related to most of the tumors are mental confusion, you can call it fogginess, or altered behavior or altered sensorium. Then you have symptoms which are pertaining to the particular location of the tumor and the type of the tissue where the tumor is coming from. So if you have tumor in the front part of your brain, it can cause, apart from headache, it can cause difficulty in your day-to-day social work, your behavior, your calculations. You can have confusion, you can have memory problems. Then in the back part of your brain, which controls the vision, if you have tumor there, then your vision is affected. There are certain tumors which sit in the base of the skull. If they are in the particular gland called as pituitary gland, which produces hormones, and in certain tumors the cells produce extra hormone, then you can have hormonal problems like acromegaly, which means your jaw becomes larger, your tongue becomes larger, and your hands become coarse and other things. And then you can have certain tumors which are called as prolactinomas, where you can have excessive milk secretion in the breast in females, impotence in males, and so on and so forth. Certain tumors which are located in the back part of your brain called as posterior fossa, they can cause difficulty in balance problems, your coordination, your hand movements and other things, as well as if they are located near the nerves, they can cause difficulty in hearing, which is slow progressing difficulty in hearing. They can cause sudden onset pain inside on your one side of your other side of the face. It's called as trigeminal neuralgia, and so on and so forth. So the symptoms of brain tumor vary a lot. Anything which you think is abnormal or remotely or closely related to this kind of symptoms, you should go to the nearest neurosurgeon or a neurologist and get yourself checked. Thank you.